Advances in colic surgery mean a better chance for survival, and researchers track the issues that most frequently necessitate euthanasia of older horses. I'm Ryder, news editor of The Horse, your guide to equine healthcare. Welcome to the Ryder Report for July 28th. A horse that colics and needs surgery has a better chance of survival today than he might have a few years ago, according to a recent review of equine colic surgery advances. Improvements include techniques to close an incision in the horse's large abdomen with greater confidence that it can hold, as well as advances in surgeons' ability to resect sections of the intestine. Read more at Article 14582 on thehorse.com. Lameness, weight loss, colic, and equine Cushing syndrome are the 4 top reasons for euthanizing an older horse, according to a talk presented at this year's American College of Veterinary Internal Medicine Forum. Dr. Thomas McGowan and colleagues surveyed owners of geriatric horses over several years, yielding information on age, breed, management, and horse health. The survey reported 91 deaths, of which 89% of the horses were euthanized. The most important risk factors included preventable or manageable conditions, including weight loss, dental disease, and equine Cushing syndrome. They recommend general health screening for aged horses with particular attention to management, diet, dental maintenance, and endocrine function. Read more at Article 14591 on thehorse.com. The U.S. Food and Drug Administration is advising horse owners to discard feed purchased at a Florence, Kentucky feed store because it could be contaminated. The agency issued the advisory July 20th when U.S. Marshals seized $24,000 in livestock food products from the Bi-County Farm Bureau Cooperative Association. Bi-County manufactures feed and stores commercial feed produced in other states. However, the contamination risk is limited only to products purchased at the Florence store. If you got the feed somewhere else, there's no problem. See a list of the Bi-County feed products at Article 14572 on thehorse.com. Baling moist hay in low wind speeds, high humidity, and hot temperatures can be a recipe for disaster. Under such circumstances, tightly stacked hay bales have been known to combust. Hay barns or other structures could be lost. Combustion typically occurs within 5 to 7 days of baling. To know whether your hay is in danger, check the temperature inside the bales. A bale that measures less than 120 degrees Fahrenheit is in little danger. Bales between 120 and 140 should be removed from a barn or structure and separated so that they can cool off. Once the temperature of a bale exceeds more than 140 degrees, don't try to move it. Read more at Article 14589 on thehorse.com. Veterinary preparations for the 54th running of the Tevis Cup, a 100-mile endurance horse ride, have kicked into high gear as the August 1st race day approaches. Head vet Dr. Greg Fellers has been working on organizing the 17 veterinarians charged with manning 9 equine checkpoints between the start near Lake Tahoe and the finish in Auburn, California. Horses are evaluated for soundness and metabolic status, including hydration, heart rate, and fatigue. Read more at Article 14605 on thehorse.com. Molly the pony, one of the world's only prosthesis-wearing ponies, will be visiting the Ohio State College of Veterinary Medicine on August 6th from 4:30 to 8 p.m. You can visit with Molly and hear a presentation by Dr. Rustin Moore, who performed the surgery to amputate Molly's leg after she was attacked by a dog following Hurricane Katrina. Read more about Molly's visit to OSU at Article 14578 and learn more about the remarkable pony at Article 6937 on thehorse.com. That's it for this week's Ryder Report. Visit thehorse.com for all the latest news on equine healthcare, management, and welfare. I'm Ryder, news editor of The Horse, your guide to equine healthcare. Thanks for watching, and we'll see you next week.